I think if I could just tell one story, and that would be my contribution to the discussion, I want to tell you about one of the cases that is mentioned in the book. It's called Simkins versus Moses H. Cone Hospital. And if you remember it, wave at me. I don't see why you would remember, but it is the watershed case that was brought by 6 physicians, 3 dentists, and if I'm remembering correctly, 9 patients, but don't hold me to that. It is the reason that we have a Civil Rights Act of 1964, and it is because providers saw their voices were needed to bring justice as healthcare, right? Justice makes you healthy, injustice makes you unhealthy. I think we can make the argument even stronger. Racism makes you unhealthy and it kills. And so that you are taking up that legacy of those plaintiffs in Simkins, that you are seeing that although this is a large problem, it's not one that cannot, with collaboration among healthcare providers, housing providers, educators, looking at all of the social determinants of health, it will be defeated. We will make a difference if there is intentionality and collaboration. The reason I raised the Simkins case is because if we had time, the case I make in Just Health, which is the proposed title for the sequel book, the case I make is that law constructed structural racism. Like, it couldn't have happened if we didn't have segregation laws. It could not have happened if we didn't have separate but equal Jim Crow laws. And it could not have happened contemporarily if we didn't refuse to enforce laws against discrimination today. But lawyers can't do it by themselves. We'll get it wrong. I said I was going to tell one story. This is the last story, and I'll tie them together. The time I spent on Capitol Hill, my job was really as a glorified receptionist. I had this fancy fellowship, but really I was the receptionist for constituents who came to the senator and wanted to press their causes. And my assignment was to sit down, take notes, and if something rose to the top of her agenda, I would put it into the Monday meeting. And I was supposed to give a certain amount of time to anybody who came. What a country. Just you knock on the door, you can speak to somebody for the senator. But if it was someone from the health care sector, because that was a priority of hers, I doubled the time. If someone from healthcare showed up at the Hart Senate office building and had a proposal, I not only doubled that time, I always brought it up in the Monday meeting. Why do I tell that? Because your voices are powerful. When you determine that you're no longer operating in the silos that your patients do not live in, they live whole lives, and where they work, they eat and they play and they worship. All of that has an impact on the health mission and the healthcare mission. When you decide to involve yourself in influencing all of those social determinants, we listen. Lawmakers listen, policymakers listen, and I believe that's how structural change will happen. The proof is Simkins versus Moses H. Cone Hospital. If you were to read what happened on the Senate floor, what senators were saying in 1963 and 64 is doctors will keep bringing these cases if we don't pass a law. I say, make them say that again. Make them say, the providers, the nurses, the respiratory technicians, the PAs, they'll keep bringing these cases if we don't do something. And so I thank you for this conversation. I thank you so much for reading the book. That's humbling and I really appreciate it. Thank you very much. And Godspeed.
Thank you so much for joining us. You've made my night. She just said, "Did that lady write this book, Mommy?" Yes. I said, yes, she did.
You did.
Omar had one question. We greatly appreciate your time.
Go right ahead.
Hi, thank you so much again for joining us. So just a quick question. So as we kind of been talking about, it's been 5 years since Just Medicine was published. And as we all know, America's current political climate is very interesting right now. So I guess our question for you is just, how has your work changed when like thinking about your approach to health and equity?
Thank you. I really appreciate that question. It's changed. My new model has the health medicine discussion at the top where individual interventions are. And as my pyramid goes down further and further, you increase in the level of structural intervention, right? So health care is individual interactions. The biases that are in this book are predominantly in in individual interactions. I go down to structural discrimination in housing, structural discrimination in education, just the fact that my Black child, your Latinx child is 6 times more likely to have an out-of-school suspension in some districts, right? You take that child out of school, they are less likely to graduate, their job prospects are harmed, therefore they're in unhealthy, polluted housing, and the sequelae just spins out of control. So I go down a pyramid now to say the intervention has to be at structural levels. That's how my work has generally changed.
Thank you so much.
You're welcome. You guys carry on. Thanks for having me.
Thank you so much.
You're welcome. Bye-bye now.
Bye.